examine the femur, that the legs must be extended so that the femur is parallel to the tabletop and the film. On the left, an accurate representation of the femur is obtained when the femur is close to the film and is also parallel. On the right illustration would be an example of an animal in which you are having a difficult time keeping the leg extended. And so the leg is pointed up into the air somewhat, and this will give a foreshortening of the femur. The femur in the radiograph will appear then to be shorter than if it were down horizontal to the X-ray film. This is a radiograph showing the leg on the right side being positioned properly where it is fully extended. You can see the full length of the femur in true perspective. The leg on the left is sticking up in the air, so the femur has the appearance of being shorter. There is also less density or less blackening of the leg sticking up in the air because of the increased thickness since the leg is not extended fully. Unsharpness can also create problems for us. Unsharpness is defined as a lack of detail, and there's primarily 4 causes of unsharpness in radiography. Number 1 is the recording system or the film-screen combination used. This area will be discussed more on the section with film and screens. Basically, the faster the screen-film combination, which means less radiation is used, usually the poorer detail or unsharpness that will be present. The other factors affecting unsharpness are penumbra, absorption, and motion. The cause of unsharpness created by the penumbra is related to the focal spot of the X-ray tube. Because of the focal spot needing to be somewhat larger to dissipate the heat and to create the X-rays necessary, we get a blurring or unsharpness at the edge of the primary beam where it crosses a particular object. We need to remember that for the most part, if we use a small focal spot, we will always get better detail. To try and show the effect of penumbra, we want you to think about the X-rays being produced at the edge of the focal spot where the arrow is, and then if you look at where those X-rays go by the object, and then they're going to create the image at the inside part where the arrow is now pointing to a part of the umbra or the actual object size. If we'll go back to the focal spot and look at the X-rays that are being produced at the other edge of the focal spot or the target, you'll notice they're going to follow a different path, passing by the object, but then they will be recorded at a far lateral side of the image on the film. This unsharpness then says that the edge of the object is not represented by a finite line, but makes it unsharp where we try to identify the edge of a given object. Absorption unsharpness has to do with the alignment of the beam with the margin of the object. If we'll look at the left-hand object, you'll notice that the beam is aligned with the edge of the object, and therefore the margin will be clearly identified on the radiograph. If we look at the right 2 objects, there is uneven absorption since the margins are not aligned with the primary beam. This will result in a less distinct margin on the radiograph. The biggest cause of unsharpness in veterinary medicine has to do with motion. The motion is in the patient of which we have difficulty in controlling. We can attempt to use adequate restraint, both physical and chemical, so that the animal does not move during the exposure, but many times that is still a possibility. We must strive to always use the fastest exposure time possible so that if there is motion, it is minimized in its effect. This videotape is on the radiographic techniques and radiation safety training for veterinary technicians. The radiologists involved in the production are Robert Lewis, Mary Mahaffey, Barbara Seltzer, and Elizabeth Watson. All four are diplomates of the American College of Veterinary Radiology and are associated with the Department of Anatomy and Radiology, College of Veterinary Medicine, the University of Georgia. Technical assistance was provided by Tim Jarrett and Ann Toth. The production manager was Gary Burton of the Educational Resources Center of the College of Veterinary Medicine. This videotape was sponsored by the Georgia Veterinary Medical Association located in Norcross, Georgia.